Nobody knows the mechanism of aging. In France, for instance, in 1950, there were 200 centenarians. 10,000 now in year 2000. So we expect in 1950, with some sort of certainty, more than 150, 200,000 centenarians in France. Makes the multiplication by, say, 5 for US and the rest for the world, and so on, millions of centenarians. The human lifespan is not fixed, contrary to the common feeling, and we could add that very likely it continue with increase in the near future. What is good? Activity, all sorts, physical, mental. Healthy lifestyle, banality, physical and mental, food, wine is not excluded. Well-tailored design medications, complement to take care of hormonal and neurological deficiency. In other words, we should try to go from frailty, vulnerability, evolution to dependence, which is the worst, to autonomy and freedom. This is a big fight. We'll win.
I think what we've seen in Etienne's very fine overview of what's happening with the demography of aging is that, as usual, science is providing a blessing and a curse, in the sense that the better we get at treating people and teaching them how to have better health standards, the longer people are living, and then the danger, of course, is that if we don't solve some of the really crucial issues like Alzheimer's, which we're going to hear about a little bit later, we're going to have one unbelievably difficult demographic problem in front of us.
With globalization of travel, communicable diseases are now becoming tremendously dangerous for our society, because especially the ones, not necessarily the hemorrhagic fevers that may actually wipe out a very large group of people, but tend to be readily self-contained because they are so rapidly acting, but rather the ones where there's a significant latency between communication of the disease and, in fact, demonstration of the symptoms. If you look right now, the drugs that have been developed in industrialized countries are really not meant to work across the world. They have been tested, and in fact, both for efficacy and safety, on relatively small segment of the population that reflect the demographics of those industrialized countries. And in fact, when you look at pockets of either sort of inbred pockets or pockets where there may be significant diversity in the genome from the population that we use in the studies, you may end up finding that certain drugs that cure, in our context, may in fact kill a group of poor acetylators that may live in the middle of Africa. And finally, I think that as in Africa, mobile telephony is sort of completely leapfrogged landlines and become a de facto standard and tremendous penetration in the population. I think that some of the challenges in creating a universal medical record in the US that were related to the fact that there were too many legacy systems may actually become somewhat easier implementation in the context of a globalized community, where some of those legacy systems may be relegated to specific individual countries, and maybe we can even use the cell phone as a universal tool to bring together the different medical records.
For the last 2 decades, we've been concentrating on digitization of biology. So as we read the genetic code, we go from the analog system of biology into the digital world, where it gets stored in computers. We're now making the transition from reading the genetic code to writing the genetic code. And I think that will be a step in humanity that once it's crossed, we will never look back. With this range of infectious diseases, we've been sampling the same tools that my team developed for rapidly sequencing the human genome. We've been now sampling the environment. And we find that instead of having one clear-cut organism, there's maybe 1,000 related organisms where their genomes differ in sequence content by as much as 50%, even though they have basically the same genes in the same order. This is very much different than would have been predicted by Darwinian evolution models, and what people have seen by isolating a few organisms in the laboratory. So as we go back and apply these same tools to infectious disease, for example, looking at the diarrheal diseases in Africa, there's probably going to be a huge range of organisms, not one or two things like cholera that really explain disease, and it's going to be a challenge in terms of how to deal with those. On the synthetic genome side, this work started by trying to understand the difference between the first two genomes that we decoded in history in 1995. One had 1,800 genes, that's Haemophilus influenza, and the other had 560 genes. We simply asked questions, what is a minimal set you need for life? Can we really reduce it to understand it? They were very naive questions. In fact, the main conclusion from the studies thus far is you can't define life based on the genetic code. You need the genetic code and the environment simultaneously. But I think more importantly, when we consider global health, if we're not considering our environment, we're wasting our time. I've argued if we're not doing something about the environment, we shouldn't waste time and money trying to cure cancer.
The brain doesn't sit alone in an organism, but rather sits inside an organism that, with which it has a full integrated interaction. So we have a brain that sits inside a body, and we have a body that sits inside a physical and social environment. And the interactions with all these compartments are very intense. They go both ways, and they are in fact quite critical to explain a variety of diseases, both the kinds of diseases that are considered mental illnesses and those that are considered body illnesses. Think, for example, about stress and depression. And you might think, well, stress and depression are really conditions of the advanced economies, not really of the whole world. And this is actually not true. I was talking with Joanna Rubinstein at lunch, and she was saying that one of the major problems in Africa right now is actually the problem of depression, which actually surprised me a little bit. So you have conditions that, whether they occur in the advanced economies or in worlds in development, are extremely important, but which are, together with a variety of factors that come out of our individual genomes, that can contribute to producing, for example, cardiocirculatory disease, stroke, substance abuse.
Currently, there are 5 million people with Alzheimer's disease in the United States, and we're spending about $100 billion annually. In 2050, this number is going to increase to 16,000. And according to the Alzheimer's Association, if left unchecked, Alzheimer's disease will destroy our healthcare system and will bankrupt both the Medicare and Medicare. It is a slow-growing tsunami that's affecting not only the United States, but the world. The number of Alzheimer's patients now in the world are 26 million, and the numbers are expected to quadruple to more than 100 million, 106 million to be accurate, by 2050. Currently, there are 16 million individuals in China, in Asia, and this number is going to increase to 62 million. Clearly, this is a slow-growing problem, and we need to do something about it now. Fortunately, there are 3 lines of research that provide hope that we can do something about Alzheimer's disease. Firstly, research shows that those who become demented don't have only Alzheimer's disease. High blood pressure, diabetes, obesity, sedentary lifestyle, the things that increase your risk of developing a heart attack also increase your risk of developing Alzheimer's disease. There are 100 new drugs in different stages of development to target and to combat the development of Alzheimer's disease. And fortunately, some of the drugs being considered are cheap and already available. Things like omega-3 fatty acid, curcumin, the spice in chicken curry, seem to be very effective molecules in reducing the aggregation of proteins that contribute to Alzheimer's disease. In summary, 3 lines of research: the fact that vascular risk factors contribute to dementia, the fact that you can, by changing your lifestyle, improve your brain health, and the fact that there are new drugs that can target the pathophysiology of Alzheimer's gives us hope that we can do something about it. I think that we should make brain health a priority, and we should do something about preventing Alzheimer's now as the tsunami is growing, rather than deal with it when it's become a crisis and we have a healthcare that's broken. Thank you.